A new oral medication to treat cystic fibrosis targets the underlying cause of the disease with the goal of preventing or slowing the development of CF-related complications. Results of the Phase 3 clinical trial of the drug ivacaftor show improved outcome measures in a select population of CF patients and may lead to a curative therapy for others. Dr. Michael Constant, chairman of pediatrics at Case Western Reserve University School of Medicine and UH Rainbow Babies and Children's Hospital in Cleveland, co-authored this international study.
This is a major milestone in the fight against cystic fibrosis. For 60 years, we've been just treating the complications of this disease, and for the first time, we have a therapy that's treating the cause of the disease.
Cystic fibrosis affects about 30,000 people in the United States and 70,000 worldwide. In CF, a genetic mutation results in a malfunctioning CFTR protein that prevents chloride movement. In a healthy lung, cilia in the airway beat in a watery layer which carries mucus from deep within the lungs to the mouth. CFTR is embedded in the cell membrane at the cell's surface, forming the protein channel that enables chloride to move from within the cell to outside the cells. In CF lungs, the loss of function of the CFTR protein channel eliminates chloride movement, which decreases salt and water at the surface of the cell. That imbalance generates a cascade of mucus and crushes the cilia and prevents them from beating, which results in infection and inflammation in the lungs.
The new breakthrough, ivacaftor, makes the abnormal protein that's at the surface of the cell work better. So the drug restores the salt and water balance across the airway. Keep the airways nice and clear, and the patients can breathe.
The ivacaftor study was conducted in CF patients ages 12 years and older with a specific mutation called G551D, affecting 4% of people with CF. The treatment improved several key outcome measures.
The patient's lung function improved significantly. They had half the number of acute infections. They had good weight gain and many less signs and symptoms that they typically experience.
Good job.
Our hope is that this drug will slow down or completely arrest the progression of the lung disease, such that these patients will then live a much longer life than they otherwise would.
An ongoing Phase 2 clinical trial is evaluating combination regimens of ivacaftor and another drug in people with the most common mutation in CF. These studies represent a major milestone in the treatment of cystic fibrosis.
We work for years and years on developing therapies to try to better the lives of our patients. And when you come across something like this, it brings you just so much hope that we really will be able to help all of our patients.